And this is the knee joint, which is the most complex joint in the body. It has a lot of different features. So superficially, from anterior view, you can see different features. You can look at the bones first. This is the femur. This is patella. This is still femur. This is fibula laterally and tibia medially. There's quadriceps muscles are located in the thigh, and this is the tendon of the quadriceps muscles that are attached to patella, the superior part of patella. And here is the patellar ligament that is connecting patella with the tibial tuberosity of tibia. These are also retinaculae, which is the plural form of retinaculum, UM at the end, UM. So this is a retinaculae that are connecting the patella and also the fibers of the quadriceps tendon to the tibia. You also have these other ligaments. So one ligament is connecting the fibula with the femur, and this is called fibular collateral ligament or lateral collateral ligament. And this one is connecting tibia with femur, so this is the tibial collateral ligament or medial collateral ligament. Also in the background, you can see the joint capsule around this area, this adipose tissue around that area. If you remove the patella and some of these tendons and ligaments, then you can see something like this. So this is the end of the distal end of the femur. So you can see the two condyles of the femur, and here is the tibia and fibula. So this is an area made of fibrocartilage, and that's called meniscus. So you have a lateral meniscus and you have the medial meniscus. So these are the condyles of femur, and these two are the condyles of the tibia. So this is how these menisci are stabilizing the knee joint. So these two condyles do not move side to side or too much anterior posterior. Okay, so this is the stabilization. There is also a couple of intercapsular ligaments are here. So this is anterior cruciate ligament, and this is a posterior cruciate ligament. I will show you this again in the next slide. And you can also see the fibular collateral ligament attaching fibula with the femur, and this is the tibial collateral ligament that are connecting these two bones, tibia and femur. This is the posterior view. So you can see the one ligament here, and this is called popliteal ligament. This is the back of the knee, and also see the joint capsule around this area, wrapping around that knee joint. There's also different muscles, but let's not talk about the muscles now. Leave it for chapter 11, and I will discuss it in more detail there. You can also see some bursae there because of the movements of these muscles. That is just superficial to the bone, so to reduce friction in that area. If you remove the joint capsule, you can see the menisci. So there's a medial meniscus and lateral meniscus. This meniscus continues as a ligament, and this is called meniscofemoral ligament. Meniscofemoral ligament. It's not written there. If you want, you can write it. You can also see the anterior and the posterior cruciate ligaments, and you see that this is the tibial collateral ligament and fibular collateral ligament. There's a lot of different images there, but the name of the anatomical features are almost the same. Does not make much changes, but you can see it from a different view. This is the side view of the knee joint. So again, this is the distal part of the femur. This is the proximal part of the tibia. You do not see fibula here, and this is the patella. So you have some bursae here. One is above the patella. This is called suprapatellar bursa. One is below the patella. This is called infrapatellar bursa, and one is anterior to that. This is called the prepatellar bursa, just below the skin. At the end of each bone, you have hyaline cartilage, hyaline cartilage, hyaline cartilage. So these are articular surfaces. This area is the knee joint, and this is the synovial fluid that's located in the synovial cavity. And this is the synovial membrane, this area. And also you see these menisci. So you see only lateral meniscus here, but you do not see the medial meniscus because the way they cut the bone. There's two intracapsular ligaments. One is the anterior cruciate ligament. Anterior cruciate ligament prevents movement of tibia anteriorly. So if this is damaged, tibia can move anteriorly, which is not normal. And the posterior cruciate ligament prevents movement of the tibia posteriorly. If this ligament is damaged, tibia can move posteriorly, which is not normal. And this is from the superior view of the knee joint. This area is the anterior. How do I know this is anterior? Because this is the tibial tuberosity. So tibial tuberosity is located anteriorly. That's one of the easier features to know. And also you should know which one is medial, which one is lateral. So this is the medial meniscus, and this is the lateral meniscus. This is the medial cartilage, and this is the lateral cartilage. So if you can see, the medial side is bigger than the lateral side because the medial condyle of the femur is also bigger. There's a lot more pressure on the medial side. So this is the anterior view, and this is the medial view. This is made of the fibrocartilage, and this is made of the hyaline cartilage. Also, you see these two cruciate ligaments. This is anterior cruciate ligament, and this is the posterior cruciate ligament.